So hello to all my dear aspirants. Welcome you to Sail to MDS Dental Academy. So aspirants, today we are here with the plan of action of our new batch which we are going to start from January 6 till your INI-CET and NEET examination. But let us conclude first our two lectures which we have conducted in this week, that what after BDS, the current scenario in dentistry, the changing pattern of NEET MDS, and how to plan for NEET MDS, INI-CET and government exam with my 10 points. So aspirant, already I talked that after BDS you have many options. You can open clinic, you can do MDS, you can go for the government job, you can go for the MBA, abroad dentistry, etc. But remember, in order to get success in life, you have to upgrade yourself. If you want to be in dentistry, you are upgraded, you are going to shine. So the best and the permanent way to upgrade is the NEET MDS. Then we talk about present scenario of dentistry. We are told dentistry is not at all saturated, but it is upgraded. So if you want to be in the market, you need to upgrade at each and every moment. You have to keep on learning. That's the only way to survive nowadays. Then we talk about changing pattern of NEET MDS. As we have seen previously till 2017, repeats were there. Only reading Pulse or the Gauri Shankar was enough, but nowadays it is not. You have to be innovative, you have to focus on the concepts, and that's your mantra for success in NEET, MDS, INI-CET and even for government examination. Then I talk about 10 points to notice to plan your performance in the examination. We are talking about which book to refer, how to divide your time. If anybody has not watched this video, you can click on the I button above and also go to description box to watch them. So you can conclude from this that in order to get success, you should have proper plan of action. Whatever you have to study, you just don't have to attend the lecture and give the exam, but you have to do something additional. If you do that, then only you can be successful for the NEET exam or your AIMS INI-CET or your government dental exam. So let's see how to do that. So first of all, I will tell how my academy is. See, we have a core team to perform on each and every subject. We focus on concept based learning. Then we follow the latest exam pattern. Whatever the changing pattern of the exam is that I follow. Then we have an online lecture format, then online exams. Then aspirant, what are the salient features of new batch that we are going to start from Jan 6? We have more than 70 lectures following DCI pattern and the books prescribed by DCI only. Then we have more than 50 exams on the mobile friendly side. You need not know to download special app for that, or you did not need any computer to give your examination. On your mobile, anywhere you can give this 50 exams. We have more than 70 MCQ discussion in which I will focus or I will bombard you high MCQ that will increase your ability to solve the MCQ. And the special way of teaching physiology, medicine and pharmacology. This year also we have seen in part A students were lagging. So we always follow this PPM system. That is, for example, if you are teaching CVS of physiology, I will teach you CVS of medicine and pharmacology. So because of that, what happened? You can interrelate that case-based question and you can answer them. Fine aspirant. So this is the salient features of our new batch. Then action plan aspirant. So what should be the action plan? So the best way I have designed. This is the sample of the January. For full action plan from January to December, the link is given in the description box. So aspirant, you can see in January we have Wednesday, Friday lectures will be there. Then Saturday we have MCQ discussion and Sunday exam. The so on, keep on following. And as well as Sunday, sometime we will have the extra live interactive session for doubt solving, for motivation, and also the image based lectures will be there. Okay, as you can see here in Sunday we have exam also and the image based lectures. Now let's see how we are conducting exams and lecture. So aspirant, we have a two format. The first format is an e-based WhatsApp lecture in which I'll provide you image, so your image based questions will get solved. I'll provide you high yield text and voice notes which help you solving the other type of MCQ like single based, multiple choice, match the following true and false, and we have explanatory videos to solve your concepts. So such e-based WhatsApp lecture are helpful to you aspirant. Why? Because most of you are doing internship till 9 to 5, you will be in the college, some of you have the clinic, some of you are doing the job. So to come on the time and attend the lecture is not possible for few students sometimes. So I kept this WhatsApp lecture which you can access anytime, anywhere at your will. Even aspirants, you are not on the time on lecture, no problem, you can download it and you can access it. Sometimes you go for some 5 to 6 days journey or your books are not with you, open your mobile and study. So that I made very easy way for the student to refer and to revise. Such lectures were very fruitful for the student during revision. Just because with your mobile only you can revise quickly, and mind it, these lectures will solve most of your purpose. So that's our first format of online lecture, that is WhatsApp based lecture. Then the second lectures are the live interaction, live online session, for the image based lecture, for the new information, for the doubt solving, and for the motivation. So that's our second format of online lecture. So we can say that we have amalgamation of the both WhatsApp based lecture and the online lecture. So students who like just offline lectures, their purpose will also get solved. Now how we take exam. So already I have told you we have a mobile friendly site. You need not need to download extra app for that, need to update again and again, or you don't need laptop also. Mobile is there, you can easily answer our exams. We have past paper collection, we have a progress unit test, PPM, we have subject wise exams, and we have the practice test for your NEET, AIMS, PGI and government exams. So that is our exam format, aspirant. Now aspirant, I just don't teach my student, I always assess them because I take limited number of students. So how to assess? I provide special assessment form. In that I will teach you how to divide your subject. Okay, you can see in this example, operative dentistry I have divided. I will tell you how to divide days, how to divide topics, how to revise, what book to refer, everything I am going to tell you, aspirant. And you have such miniature assessment form with you, which you can download, or you can take print out. In this assessment form you can just see, you can write how many days you want to give to the subject, how many days you have taken, have you attended academy notes, video attended, have you read synopsis or not, have you practiced MCQ or not, or you attended exam or not, you have given online exam or not, or you have referred textbook or not. So like that you can comprehensively attend it yourself. At the same time you can also write some topic you have left. So such assessment form will help you in your completing your backlog, there is remaining work, and to evaluate your progress. The progress evaluation is crucial during exam preparation, and also final conclusion I give at the end of every month to all my students. So along with the preparation, we also assess that whether you are doing right or not. Okay aspirants, so that was about it. So from 6th Jan, new batches there to join. You can DM me, you can email me, or you can go to our website also. There also the live chat box is there, 24 hours we are helping our students. Okay aspirant, so any doubt regarding your preparation, you can contact me, because the time has been come now to start your preparation for the coming year to get success in the examination. So aspirant, take care, keep on working. This is our third complimentary lecture. We are going with the fourth and fifth lecture within 2 days. To join that also you can DM me. Thank you all.